We begin with the ongoing fight against the coronavirus. The U.S. is combating a post-holiday spike in Omicron cases by expanding its COVID-19 booster efforts to adolescents. The FDA authorized a third Pfizer shot for children between the ages of 12 and 15 earlier today. The agency says anyone in that age bracket is eligible to receive the booster 5 months after receiving their second dose. The CDC is expected to rule on the decision later this week. It comes as millions of children return to classrooms following the holidays, while millions more find themselves once again enduring remote learning. More than 55 million people have tested positive for the virus since the start of the pandemic. Just last week, the average daily number of COVID cases surpassed 300,000, with nearly 500,000 cases reported on New Year's Eve alone. CBS News' Wendy Gillette has more.
With millions of children heading back to class today, many of them may soon have some extra protection against COVID-19. The FDA has authorized Pfizer vaccine boosters for kids ages 12 to 15, 5 months after their last dose. The CDC still needs to sign off on the plan. Across the nation, the number of new cases reported hit an all-time high last week, nearly 500,000 in one day.
Omicron will spread. We're going to peak over the next several weeks, particularly in areas that had an early onset of Omicron, and then it'll go down afterwards.
The latest surge has some educators and parents questioning whether schools can open safely. But New York City and other big city school districts are bringing students back today.
I know there's questions about staffing. I know there's questions about testing. There's a lot of questions. But we're going to turn those question marks into an exclamation point. We're staying open.
To keep schools open, many districts are sharply increasing the number of students tested each week. In Florida, where positive COVID cases soared past 40,000 per day last week, the governor addressed the spike.
In Florida, particularly South Florida, we do believe it's overwhelmingly Omicron infections that are occurring, but Delta is still there, and most of the people that get really seriously ill are still being infected with the Delta variant.
Health experts continue to urge mitigation strategies to control COVID, like mask wearing, social distancing, and vaccines. Wendy Gillette, CBS News, New York.
Joining us now for more on this is Jody Guest. She is professor and vice chair of the Department of Epidemiology at the Rollins School of Public Health at Emory University. Professor Guest, welcome. So as we've been saying, the FDA is authorizing the use of Pfizer's booster shots now for kids ages 12 to 15. What difference do you think this will make for children being able to attend classes in person and just in general?
I think that this is a wonderful move, and the science backs this up, that this is safe for these children to get these boosters. And this is exactly what we need to have happen as we bring people back together for school. And these 12 to 15-year-olds need that extra dose of protection that this booster will provide for them.
Professor Guest, I'm very happy to hear this news because I'm a parent with 2 kids who fall into this age range. But I got to say, my 15-year-old is about 4 inches taller than me and quite a bit larger. And sometimes I wonder, shouldn't he be getting a third dose of an adult-sized vaccine? I've had, at this point, 3 doses of the adult vaccine. And I wonder whether 15-year-olds who are of a certain weight and height shouldn't be getting an adult-sized booster.
That's an excellent question, and one we've heard a lot. But what we are talking about with the different doses is what's the immunological age of the child, not the size of the child. And so this was very much based on how advanced their immune system is. And so they're getting the right dose at the aged dose that the FDA has authorized.
That is very reassuring. Thank you, Professor Guest. But of course, there are also still many children who are not vaccinated, and we are seeing an uptick in cases and hospitalizations in children. What are we learning about the virus's impact on those younger patients?
Well, what we're seeing is that hospitalizations for children right now is higher than at any other point in time we've seen in the pandemic. And that's alarming. We are not seeing very many deaths from kids, and that's the fantastic news. But they are the least vaccinated group among us right now. Only about 15% of our youngest group that are eligible for vaccines are currently fully vaccinated. So they're the most at risk. And so adding boosters on, making sure we're masking when we're indoors for school, these are really important measures to put in place to make sure we're protecting our kids, as well as routine testing. This is something we really need to be talking more about.
And the FDA's authorization comes, of course, as students are returning to school following holiday break. And as many employees are returning to the office, most doctors say they expect these next 6 weeks to be difficult. How long do you think it will take before we see the full impact of Omicron?
I think that we're going to start to see it peak in some of the states that saw the earliest cases of Omicron in the next probably 2 to 3 weeks. And then we're going to see it trickle across the United States the way Omicron has spread. And so I do think we're still in for a very tough 4 to 6 weeks across the United States. And this is, as you said, right as kids are going back to school. So we want to be really careful as we protect our most vulnerable among us.
And Professor, last week the CDC shortened that mandatory quarantine period for asymptomatic infections. It's down now from 10 days to 5 days. And now officials are saying they could require an infected person to test negative before they're able to leave isolation. What is your take on this evolving guidance? Because it is a little confusing to some people.
It is absolutely, can be very confusing, and the science communication across these new changes is important. I think that we will start to see more of a conversation about requiring a negative test to come out of quarantine early, and I think that that will be the right move. There's some very, very good data from the UK that's been using antigen tests, negative tests on 2 different days to come out of quarantine on the early side, and making sure that that is not putting people who are infectious back into the general population. So that's the right way to use it. And I hope that we're going to see CDC moving that direction. When we think about antigen tests, what we want to be talking about is those tests are helping us answer the question, am I contagious? And that's why we want to use those tests to know that we can come out of quarantine on the early side.
Professor Jody Guess, thank you so much for joining us. We really appreciate all your medical expertise in this matter.
Thank you for having me.